Namaste. Myself, Name-Shivi Saxena, Faculty of Physiotherapy and Diagnostics. Discipline is Medical Laboratory Technology. My topic is Chikungunya. What is Chikungunya? Chikungunya is a virus that is transmitted from human to human mainly by infected Aedes albopictus and Aedes aegypti mosquitoes, later referred to as Aedes mosquitoes, acting as the disease-carrying vector. Chikungunya causes sudden onset of high fever, severe joint pain, muscles pain, and headache. As no vaccine or medication is currently available to prevent or cure the infection, control of chikungunya involves vector control measures and encouraging people to avoid mosquito bites. Cause change in vector distribution due to global warming and changing weather pattern. Outbreaks and cycle of chikungunya. Outbreaks occurs during rainy season with increasing density of Aedes aegypti mosquitoes bite infect the human. Laboratory acquired infection can also occur. Cycle. Aedes mosquitoes feed in daytime, breed in stagnant water, small pods, reversible primates, and transmit via 3 to 7 days. This cycle of infection: man mosquito and man. Clinical features: event, manifestation, and disease. Features: incubation 3 to 12 days, and fever may rise to 103 degree centigrade to 104 degree centigrade with rigors. Bulimia leads to fever. Fever leads to release of large amount of the interferons. And mastication: fever, cramping, joint pains, lymphadenopathy, conjunctivitis, maculopapular rash may lead to hemorrhages. Investigations: fever is biphasic with remission after 1 to 6 days of fever. Clinical event: first, entry of mosquito, and second, spread lungs, and third, disease, infantilitis, febrile illness, and rash, and then exit or that end. Clinical disease: significant morbidity, minimal mortality. Fever, rash, nausea, fatigue, and days to weeks. Arthritis may be long term. Diagnosis of chikungunya. WHO. Several methods can be used for diagnosis. Serological tests such as enzyme-linked immunosorbent assay, that means ELISA, may confirm the presence of IgM and IgG anti-chikungunya antibodies. IgM antibody level are highest 3 to 5 weeks after the onset of illness and persists for about 2 months. The virus may be isolated from the blood during the first few days to infection. Various reverse transcriptase polymerase chain reaction methods are available but are of variable sensitivity. Some are studied um, to clinical diagnosis. RT-PCR products from clinical sample may also be used for genotyping of the virus, allowing comparisons with virus samples from various geographical sources. Laboratory diagnosis. At least one of the following tests in the acute phase: virus isolation, presence of viral RNA by RT-PCR, presence of virus specific IgM and IgG antibodies in single serum sample collected, and seroconversion to virus specific antibodies in samples collected at least 1 of 3 weeks apart. Treatment and vaccines. Chikungunya fever is not a life treating infection. Symptomatic treatment for getting pain and fever using anti-inflammatory drug along with rest usually suffice. Recovery from chikungunya is the expected outcome. Convalescence can be prolonged and persistent. Joint pain may require analgesics यानी कि pain medications and long-term anti-inflammatory therapy. And vaccines, an experimental live TSI-GDS 218 enveloped by passes of an isolate from Thailand in MRC 5 cell. Preventive measures: wear long sleeve shirts and long trousers, use mosquito repellent coils or other device that will help fend off mosquitoes. If possible, sleep under bed net pre-treated with insecticides. If possible, set the air conditioning a low temperature at night as mosquitoes do not like cold temperature. Pregnant women, children under 12 years old, and people with immune disorder or severe chronic illness should be given personal advice. And breeding places of Aedes mosquito try to eliminate. Current research on chikungunya. Researchers at the institute have managed to retrace the origin and evolution of the chikungunya virus in the Indian Ocean through complete sequencing of the genome of 6 viral strains isolated from patient foreign Iceland and the Seychelles, as well as partial sequencing of the viral protein even from 1 to 7 patients from the Indian Ocean Iceland. Their study published in PLOS Medicine opens up new research paths that should help to explain the magnitude of the epidemic and occurrence of several forms of the disease. Thank you.